There are several tests that we recommend at the center to better understand you and customize your treatment plan. Some of these tests are genetic, so they're based on your genes, and the tests are for both partners. And that's what we're talking about today on Lunchtime Live at the center. We are welcoming our newest lead physician on staff, Dr. Prachi Godiwala, who is here to talk about genetic carrier screening and PGT-M. These are two screening tests that may be recommended for you when you're a patient with us. Dr. Godiwala, welcome.
Thanks for having me.
Yeah, so we have a bunch of tests. Can we talk a little bit, let's talk about genetic carrier screening and what it is and why it's recommended.
Sure. So genetic carrier screening it's a really important part of family planning and a really important part of, your process as you kind of go through the beginning stages of planning your family. Basically, what we do is we check for different diseases that are genetically related or genetically caused, and we can tell whether you are a carrier for that disease. Carriers are typically healthy individuals. They don't have any outward signs or symptoms of disease and often don't know that they are even carriers. But what can happen is if someone who is carrying a disease tries to create a family with someone who is also a carrier for the disease, they can have an affected child with the disease. And so that's why we recommend carrier screening in that case, so that you can plan for the healthiest family possible and avoid that.
And I mentioned it being recommended. Is it required? Is it something that you recommend to everyone?
It's not a required test. We certainly have people who don't want to do it, and that is totally fine. It is something, like I said, that's recommended just because we want to help you have the healthiest family possible as well.
Is it possible that for a couple that's having a hard time conceiving, that one of the reasons could be a shared gene, a shared disease or gene for the disease? Is that how it works?
Typically not. Typically, the diseases that are tested for are not related to fertility. They are diseases that are, totally related to other organ systems. That being said, there are some diseases that are genetically related that can also cause difficulty getting pregnant. One of those is Fragile X. Typically, if you are a carrier of the pre-mutation for Fragile X, and I know this is kind of getting a little bit into the nitty-gritty of that, but if you are a carrier for Fragile X, then potentially you could have lower ovarian reserve or lower quantity of eggs in your ovaries. And if that happens, it can make it more difficult to get pregnant. It totally depends on the disease.
Oh, okay. And is there a large number that we screen for?
A large number of diseases that are screened for? Yeah.
Right.
When genetic carrier screening was first offered, there were only a few diseases that were tested for, but now we're at the point where we can test up to 500 genetic diseases.
Wow. Okay.
Yeah. It depends on what panel you order. There's some that have only 200 or 300. As time has gone on, more and more have been added to that panel.
So we help a patient make the decision on which panel to order?
Typically, it depends either on insurance or what is the most cost effective to order. But a lot of the different companies, they offer kind of similar amounts.
Got it. So do we do the testing, or is it somewhere, do we send out for this type of testing?
Yeah, your physician orders the testing, and we have the kits to do them in the office that we can either do here or we can send to you, and then they get sent to the company, and then the company does them.
So, and it's a blood test?
It's either a blood test or a saliva test.
Oh, okay.
Yeah.
So someone takes the test, then what happens after they take the test? How long does it take to get the results? Who gets the results?
Gotcha. So the first thing that happens once you take the test is we send it to the lab. Typically, we'll test the patient, the female partner first. If it's a same-sex couple, we'll test the egg source, whichever person is providing the eggs. After they send in their test, it typically takes a couple of weeks for results to come back. Um, it depends on the company and it depends on the panel that is ordered, but that is common for it to take a couple of weeks for them to run that sample and then give us a result. Typically, the results will come to your doctor first, and the doctor will check on the results, and then they will get released to you as well. A lot of companies are great, and they actually have patient portals as well, where you can check on your results, and sometimes the doctor doesn't even have to release them to you. They just get released directly to you through that patient portal. So that's a nice option as well.
Is there someone who's available to offer some sort of genetic counseling around this if need be?
Yeah, so not only do we have our genetic counselor at UConn, who we work with really closely, and we have a good relationship with them, but each of the companies doing genetic carrier screening also has genetic counselors on staff who are really used to talking to patients who receive abnormal results or just any result that they have a question about.
Oh, good. Just want to make sure.
And I believe the consultation with the genetic counselor at the genetic testing company is actually covered. It's part of the package.
Okay. You had mentioned the tests that we recommend would be dependent on insurance. So does insurance typically cover this?
Yeah, a lot of insurances do cover this. I believe Anthem covers it. It kind of depends on whether your insurance does cover it, but I believe most of them do. Even if insurance does not cover it, one of our partner companies that we work with has offered us a package where the patient will only have to pay $99 out of pocket in order to receive this test.
Wonderful. Okay, so moving from carrier screening to pre-implantation genetic testing, so PGT-M in particular, can we just first go over what pre-implantation genetic
Yeah,
testing
absolutely.
is?
So pre-implantation genetic testing is when you create an embryo and you want to see whether that embryo is a carrier or unaffected or affected by a particular genetic disease. So say both parents are carriers for cystic fibrosis and they want to check whether that embryo is affected by cystic fibrosis. They would do pre-implantation genetic testing for monogenic diseases, or PGT-M. So what happens is when that embryo is created at the blastocyst stage, which is typically day 5, day 6, or day 7 after the egg retrieval and fertilization, they will, in the lab, they will do a biopsy of the placental cells, the cells that are not the baby, but they'll take a little biopsy of 5 to 8 cells and send that to the genetic testing lab. And the genetic testing lab will be able to tell whether that embryo is affected or unaffected or a carrier for that specific disease.
Got it. Brilliant. So it would go, the woman tests for carrier screening.
Mm-hmm.
If she comes up positive, then the male, the sperm, the male, the person who offers the sperm gets tested as well. And then if both of them are positive, then post retrieval, you take the embryo, freeze it, and have it tested.
You actually do the biopsy before you freeze the embryo. We keep the embryo here in the lab frozen, and that biopsy goes to the lab while the embryo stays in our lab. So the embryo doesn't go anywhere. It's just the sample that we send to the genetic testing lab. And then those results from the biopsy take a couple of weeks to come back as well.
Got it. Great. So there are a couple of different types of PGTs. So what is the difference between PGT-M versus
So PGT-M is
PGT-A?
what we just talked about. You're testing for a specific genetic disease based on carrier screening, based on family history, or if you just already know that you are a carrier for something. PGT-A, the A actually stands for aneuploidy. So, what we're looking for in that scenario is whether the embryo has a normal number of chromosomes or not. We all have 46 chromosomes, and we're all either XY male or XX female. Um, and so there are some genetic diseases that can give you more or less chromosomes. So preimplantation genetic testing for aneuploidy tests for all of those chromosomes, and it's basically just looking at chromosome number. So you might get a result that says, oh, this embryo has an extra chromosome 15, or this one is missing a chromosome 1, and there should be 2 copies of everything. But it will be able to tell you if the embryo number, or sorry, the chromosome number in each embryo is correct.
Got it. Okay. And when it comes to PGT-M,
so
who should
people
consider
who
that?
are carriers for a specific disease, and their partner is as well, and they do have a chance of having an affected child, they are the ones who should consider doing PGT-M. Whereas for PGT-A, we actually recommend that typically in our older patient population. There was a big study that came out showing that anyone who is, 37, 38 or older really could benefit from doing PGT-A because it decreases the number of miscarriages, and it increases the number of ongoing pregnancies that those patients have if they transfer a euploid, a normal embryo, which you would only know if you had done PGT-A.
Gosh, the technology is amazing.
It's great.
Yes. Anything else you think we should know about these carrier screening tests?
I think that carrier screening is super important. I also think that the preimplantation genetic testing is important. Of course, you have to make the right decision for your family, whether it's something that you want to do or not. I will say that PGT-A has also gained renown because it's actually a test that can give you the sex of the baby prior to even implanting. Which is kind of nice. We do a lot of PGT-A for family balancing. So patients who already have a child and they want another child, and they may want the opposite sex or the same sex as the child that they already have. We do see a fair amount of that as well.
Excellent. Okay. Well, thank you very much for your time today, and welcome to the center.
Thanks so much.
You've been around for a little while, but now you're here as a lead physician, so that's wonderful.
Thanks for having me.
You're welcome. And thank you for watching today. And for more information on genetic carrier screening and PGT-M, please check out our website at yukonfertility.com. And we will see you next time for another Lunchtime Live at the Center. So bye for now.